COVID-19 is having devastating impacts on communities that are already facing health conditions, especially those with weakened immune systems. AICAF is dedicated to making sure Native families with cancer are connected and cared for. We want to thank you for taking the time out today to join us on this conversation. We hope to leave room for questions at the end of the discussion. So also please ask questions in the chat box for those on Zoom and those that are joining us via live Facebook, and we'll be sure to address them. And if we're unable to get to them, we'll definitely follow up with you. As we get started, I think for sure in our Zoom, we wanted to know where everyone is joining us from. So please participate in our Zoom poll, or you can comment in the chat box or the comment section on Facebook. So I'll give a couple seconds for that one. About 10 more seconds, and then Misha, you're able to end it, correct? And then show the results?
Right.
Awesome.
I think that was 10, so I'll end the poll now. I'm sharing the results. This is where people are joining us from today. So if someone from the Midwest, a few people from the Southwest. I know we have people joining us on Facebook right now too. So thank you guys all for being here. We're very grateful.
So today we are joined by two of our board members, Nicole Hallingstad, who is Tlinglit and owner and CEO of ANA Solutions, and Dr. Benally Thompson, White Earth Ojibwe, and palliative care physician at the University of Wisconsin School of Medicine and Public Health. Welcome. So please, I want Nicole and Dr. Benally Thompson, please introduce yourselves.
I'd be happy to, and it's my pleasure to join this discussion today. Chakla yuchat dosauk, ye hayachat, taktin ton nachat seti, sakwedi yadi yayachat, Norwegian yadi yayachat. So I just told you in Tlingit from Alaska that my Tlingit name is Chakla, which means mother eagle. I'm of the Raven Moiety Sea Pigeon clan, and I am the child of killer whale and Norwegian. Thank you so much for having me.
Thank you.
Miigwech, Nicole, and miigwech to everybody bringing us together. Anin Anishinabidug, Bejugo Kamignandigu, Minawane Tawachi Webdigu, Indu de Mikanak, Gawa Baba Ganakug and Dunjaba, Middleton, Wisconsin, and my English name is Bret Benally Thompson. As they said, I'm a palliative care physician at the University of Wisconsin in Madison, and I work both at the University Hospital and at one of our community hospitals here in Madison. My Ojibwe names are Bejugo Kamignung, first layer of earth, and Netawachiweb, eagle mountain feather, given to me by my two beautiful We'es who have gone on to the next world. I'm enrolled in the White Earth Reservation, so in Ojibwe, French, and Swedish, and like so many of us, mixed. And Nicole and I forgive each other for being Norwegian and Swedish, but I'm, like I said, enrolled in White Earth Reservation. So thank you for allowing me to talk to you today, and I'll do my very best to give you the best words I can from my heart and from the knowledge that I know. Miigwech.
Great. Thank you guys so much for introducing yourselves and for being here with us today. I'd like to just kind of point out that this is kind of a conversation. So as we go through these questions, you guys can feel free to respond on each other's comments or answers. And then again, just to the audience, if you have questions, feel free to leave them in the chat box. So the first question that I have is for Dr. Benally Thompson. Let's start with you. Can you share with us what palliative care is, please?
Sure, it's a great question. When I start talking to patients and their loved ones about what it is, I first ask them if they've ever heard those words before, because some people always, it's a word they've never heard, or it's a hard word to say. It actually means, if you look it up in the dictionary, it means to cloak, which after doing this work for many years, we cloak symptoms, but I think we also work to bring light to what's going on with people. So the biggest things that I do, that I'm asked to do as a consultant in palliative care, is to come talk to people about what they're faced with and help them make the best decisions for their treatment. And unlike hospice, which is for the last 6 months of life in our country, where we think people have 6 months or less to live, palliative care can be involved at any point from the time of the diagnosis of a serious illness to the end of life. So I do take care of people at the end of their lives also, but I also take care of people early in their diagnosis and just help them make the best decisions. I think often physicians or providers and patients and families, if they've ever heard of palliative care before, since it's so closely tied to hospice, that sometimes they think either the physician thinks they're giving up on their patient if they refer them to palliative care, or the patient or families think that their doctor is giving up on them, when really we just have another unique set of skills to come help think through the big picture. The other thing we're also asked to do is help with symptoms or discomfort, like pain, shortness of breath, nausea, any number of symptoms that we're experts in helping to take care of. So the other thing I tell people is we're another layer of support. Palliative care teams are interdisciplinary teams, so they usually include a physician, maybe a nurse practitioner or a physician's assistant. They have a nurse, they have a social worker, which I would say we can't do palliative care without a social worker. So shout out to all those social workers out there. My work grinds to a halt when our social worker is off. And then chaplains or counselors, as they're sometimes called, and they're an integral part. So we have a pie pie diagram that's up in our workroom, and our work includes the physical, which we are focus on all the time as physicians, but we have that pie up there to remind us that there's a psychological, emotional, spiritual side to us. So we look at the whole person, and not just who they are within themselves, but in their community, within their faith community. And so we really look at goals and values of the person, trying to help them make those decisions for their treatment, whether that's aggressive chemotherapy or other aggressive treatment, to focusing completely on their comfort and their quality of life with whatever time they have.
So I think we were going to ask a follow-up, but you really went into that really well. So thank you. I think that even shed light for some of us who do this work every day. So thank you for that. Just kind of maybe related to this, Dr. Benally Thompson. So as we think about this conversation of COVID-19 and cancer, so are there precautions for COVID-19 in those in active cancer treatment, the same as those in palliative and end-of-life care? And maybe kind of talk about some of those differences if there are.
Sure. So I was thinking about this question. I think I'm going to take the liberty to compare someone who's on active cancer treatment with someone who is healthy. Certainly there are precautions we take with people with that are in palliative care or at end of life. If you're involved with palliative care, that means you have a serious illness. So you could be more susceptible to any virus or bacteria compared to a person that doesn't have any serious illnesses. But cancer presents some unique issues with our bodies. both if you're in treatment or your cancer is active. You know, when we have cancer, just in general, our bodies are more susceptible to infections, whether that's from a bacteria or a virus. And, you know, COVID-19 is a virus. It's a different creature than a bacteria, but they still all present themselves as potentials for causing infection. So also frequently when you're getting active cancer treatment, and it depends upon the cancer treatment, depends upon the drug that's being used, but our cancer treatments alter our body in some way to try to fight the cancer or beat the cancer back enough in order for our own immune system to take over and fight it the rest of the way. In other words, try to get rid of that cancer or keep it at bay. So one of the ways that chemotherapy works is to kill fast-growing cells, and fast-growing cells occur all throughout our body. You know, cancer grows often very quickly, so that's why some of the chemotherapies target fast-growing cells. But our immune systems are also very fast-growing cells in our bodies, and so often all the cells in our body that are growing quickly are targeted by that chemotherapy. As our therapies get better and better, we're doing what we call more precision medicine, where they can target certain types of fast-growing cells. In this case, you know, hopefully cancer. But so that's a big push and big area of research in medicine. But currently, a lot of our chemotherapies target those fast-growing cells, which is why people lose their hair with some chemotherapies, because those cells are fast-growing. Why some people get affected in their gut, you know, and have diarrhea and stomach problems, because the lining of our gut is very fast-growing. So because those therapies can suppress our immune system, or just the fact of having some cancers, not all, can suppress our immune system, we're more susceptible to infection, including the COVID-19 virus. And you know, if you get a cold while you're immunosuppressed, is the medical term for your immune system not working as well as it normally does, you know, the cold might be worse. Well, if you get COVID and you would have normally, you know, done pretty well through it, you can get much more ill and require hospitalization. So the safety precautions that we ask people who are on active cancer treatment, you know, we ask them to go kind of beyond the standard precautions. So it's just so important to take those measures to protect yourself and the people around you who will have contact with you. We can talk more about those measures later if we want to.
I had to unmute myself. I always forget about that. All right, so this question is for Nicole. Living with cancer in a pandemic is very unique and probably trying experience. So if you could share with us your experience with treatment during COVID-19, as well as some precautions that you've taken to safeguard your health, that would be really helpful. Yeah, so have you taken yourself?
I'd be happy to. So this is actually my second experience with cancer. I was diagnosed with breast cancer in 2007, and just in December of this last year with ovarian cancer. So I was amazed at how much I was able to apply from my first experience through, and you know, how much it informed my care for my second go round, even though it was a different type of cancer. But it was so unforeseen, the fact that we would be in the midst of a global pandemic while I was being treated for my cancer. And to call it unique is one of the nicer words that I would use, one of the more gentle words that I would use. It poses its own set of challenges. And for anybody who might be joining this webcast or viewing it later, for anybody who is going through treatment during this time, please reach out to resources, because there are so many resources available to you. And it is an extra added level of stress and anxiety and concern on top of your standard care. You're trying to receive good care in the middle of a pandemic. I'm currently talking to you from Bethel, Alaska, which is completely off of any road system in the state of Alaska. The communities in the western region of Alaska are connected by river systems. So for me to get the chemotherapy that I needed, I had to fly every 3 weeks for 6 months to the city of Anchorage. So it was a real example of the disparities of healthcare between our rural communities and our urban centers. So on top of just the burden of facing treatment and a cancer diagnosis, I had to travel every 3 weeks. And so one of the lessons that I kept repeating to myself, which I think is helpful for anybody in cancer treatment, is to focus on the things that you can control. Because there's so much outside of our treatment experience that we cannot control. And when you're facing a virus and you have to take extra precautions, it was really helpful just to know, okay, I can't control the people around me who might not be wearing a mask, but I can do the best for myself. I can wash my hands often, I can wear a mask, I can sanitize the area around me, be respectful of the rules that my treatment center has put into place. There was so much else layered in on treatment that that did make it an extremely unique situation. So again, for anybody who might be a patient in care or just emerging from treatment or facing a new diagnosis, think about the things that you can manage, that you can exert some control over, and use that as your guide to feeling centered, to feeling like you're managing your health as best as you can. And my heart certainly goes out to all of our cancer patients. We know that American Indian and Alaska Natives are disproportionately affected by this disease. And I'm so grateful that the American Indian Cancer Foundation is such a resource for information, for tools, for webinars like this, for discussion to help people make their way through that journey.
Misha, did you have a follow-up question?
I do. I have a follow-up question. And so this is for both Nicole and Dr. Bret Benally Thompson, saying your whole name. Yeah, so my question is kind of, so you can answer it from the provider's perspective and then also as the patient. So what are some questions that patients and caregivers, so survivors and caregivers, can ask of their oncology team that will kind of maybe give them more security or lessen their anxieties around the pandemic, and just in general too, if you have any ideas around that, that would be helpful.
I would defer to the doctor first, and then I'd be happy to add some information as a patient.
Well, Nicole's been living this, and like she said more than once, so her input is invaluable. As I gather my years, I gather my chronic health problems as well. So luckily, I'm so thankful that cancer has not been one of those, and but I learned from my colleagues and my friends, my fellow board directors, on how to face that well. And I learned that from my patients. I've had a career full of how to face something that's really hard to face from so many people that I've helped be part of their lives and care for. So I would, one of the themes that's gone through these questions as I was thinking about them is something Nicole has said already is that, you know, you are responsible for your health and your health care. Not that you're responsible for all of it, but you're responsible for engaging in it. And so I encourage you, I guess that's the better word, you know, I encourage you to be a partner with your oncologist and with your oncology team, which includes social workers, nurses, schedulers. I will tell you, since this started coming at us, since COVID started coming at us in January and February, and our teams have been in high gear since March, constantly evolving and trying to figure out the best way to take care of the people that come to us. And palliative care at my institution is housed with the Division of Oncology and Hematology. So my most close colleagues are oncologists and hematologists, and that's who I meet with every day or every week. You know, even our unit is housed within the oncology unit at the University of Wisconsin. So behind the scenes, there's all this work that's going on trying to do the best for our patients. I mean, when this first happened, we couldn't even bring the patients to the clinic, which is a huge stress for people. And, you know, coming to the infusion centers, like Nicole had to fly to Anchorage, you know, it was, how do we bring people the most safely into those infusion centers and, you know, give them their chemotherapies or their other therapies or blood or platelets, whatever they need. But without the feedback from you as the caregivers or the patient, the person dealing with and living with this disease and the burdens of it, you know, we don't really know what that person's going through until they tell us. Mm-hmm. And when I talk to people about what they're faced with and the choices that they make, you know, I ask them to think about weighing the benefits of the treatment with the burdens of the treatment, not just the risks, because there's risks with anything we do, but there's also burdens that we do. And Nicole just named a huge one, you know, living in Bethel, which I've lived and worked at in Bethel several years ago when I was a resident in Alaska. Love Bethel. You know, she had to get on a plane and fly to Anchorage, you know, for every infusion. That's a huge burden on her. So, you know, there's a lot of words for me to say in a short sentence, that you need to let your oncology team or your hematology team know what you're having to go through and what you're concerned about, what you're anxious about. So either you can work together to work through that, or they can assure you or reassure you that, you know, what you're worried about isn't really something to worry about. So you can focus your energy on something good.
That's actually a great segue to a question that I get asked all the time from other cancer patient groups, and that is, you know, how do you prepare yourself to deal with possible side effects of treatment? And it's so important to put yourself in a headspace where you're comfortable asking questions, and asking more questions. So, you know, particularly now in an environment where you're managing your own health, but you're also dealing with the public health issue of a pandemic, you know, ask those questions about, well, what is the interaction between, you know, my mask wearing or my medication? You know, ask, should I happen to get exposed or get this virus? What might that look like for me? You know, everybody has different mechanisms for managing their own concern or their anxiety or their fear around a disease. Some people are comfortable spooling out a scenario where they have to face the biggest challenge imaginable and then preparing themselves mentally for that. But one of the things that I also say is it's your care team's obligation to give you the information about what you might experience, what your side effects might be. And while that can be overwhelming, this information just sort of flows over you when you're in the middle of, hearing what always sounds like very challenging news, and then, learning about your treatment and finding out about side effects. But one piece of input I've given back to my care teams through both of my experiences is, don't forget to mention that there's a spectrum of experiencing side effects, and one end of that spectrum is the very light end, where you may not experience some of the worst of the side effects. You may not experience, some of what is typical for a patient. And I've had people come back to me and say, it was such a relief for me to hear you say that, especially knowing that you've been through it twice, to know that my expectations didn't have to be completely, fear-based, that yes, I've got this information, I understand what some of those side effects might be, but I also might be, not impacted by that. And to even consider that is a little bit of a release valve for, all of the fear and the overwhelming sense of, what is treatment going to feel like for me? How is my body going to respond? One of the most frustrating things I think we can hear as a patient is that everybody's different, and how your body tolerates your treatment is going to be different from other patients getting the exact same medications. And that's hard to hear, because you want to know that there's a medical standard and that this is what my experience curve will be. Get the best information you can, get your questions asked. Consider that there might be a lighter end of experience for yourself, and then, do whatever exercises or mental preparations or spiritual, guided preparation you need to take for your treatment and for this journey.
I feel like we could go off script because we're having such a great conversation. And then I could be like, I didn't live in Bethel. I went there for a week and it was beautiful. And I want to give you so much love and energy, Nicole, for being able to get on a plane. I can't imagine, when we're sick, to just have to leave the house, but to have to do that for your care. So sending you so much love for being able to endure that and to have the strength for that. So
goodness sheesh, it's not an uncommon experience, and I'm so glad that we're working to try to bridge that gap of healthcare availability, access, and try to bring down some of those differences that we have in access to healthcare in our more rural, especially among our Indigenous populations.
Right. Misha, have you been to Bethel? We'd all have something in common other than AICAF.
I haven't been to Bethel, but I've been to Alaska and I love it.
Okay, we'll take that.
I'll actually add to some to what Nicole said is, it reminds me of how many other resources there are just besides just your doctor. Your doctor is an overwhelmed individual on a daily basis. I can attest to that. We have the resources to do the work that we need to do to take care of you, but there are so many other people involved in your care. So, a lot of us nowadays have this electronic communication, with what's called My Chart, or, a way to talk to your teams. But there may be resources and people that are part of our resources at your cancer center or at your, your health system, whether it's tribal or other, that you may not even know about. So asking the social worker, or asking your doctor, or asking the nurse, what other resources are there, or getting, so there are health psychologists, which, people tend to like shy away from right away. But the anxiety and the fear that we generate within ourselves without the information, like Nicole was just saying, can really be overwhelming, and actually can suppress our immune systems even more when we're frightened or stressed. So just talking to somebody, a palliative care team, especially one that's housed within the oncology department, because we put palliative care providers in cardiology and gastrointestinal diseases and different areas, including oncology. And they have part of the beauty of being a palliative care provider is I get more time than your oncologist might get for a visit. And so I get to listen to you more, and we can talk through these things that you're concerned about. And then I'm a direct line to your oncologist, you know, that I can ask him or her those questions and get back to you on them. But, you know, there are many members of the team, patient advocates, patient guides, can be within your system. You know, you just have to ask those questions. So I love Nicole's ask. You know, that until you ask, a lot of times you don't know. So thanks for that, Nicole.
You bet.
Yeah, I think that's really important, is empowering the patient and also the families to be able to have important conversations that are with things that are on their heart and obviously in their bodies. So thank you for lifting that up. I am going to ask Dr. Benally Thompson now. So cancer and other serious illnesses can create a deeper relationship with those in our lives who might become caregivers. Since cancer and other illnesses can affect the body's immune system, what are some techniques that palliative caregivers can use to keep themselves and their loved ones safe?
Yeah, so for another serious illness or chronic disease, you know, called dementia, I remember these posters that that one of the dementia societies put out once, and there were one was of a elderly gentleman with like a tray of food in his kitchen, and he was a caregiver, and they had him dressed in a Superman outfit. And I think another one was an elderly lady who was dressed as an angel. So I think the role of being a caregiver can be, it's beautiful, and you know, it's done out of love and for all the reasons that we are in our relationships with those people we love. But it can also be very overwhelming, especially if you're a single person trying to support that person with that serious illness or with cancer. So, you know, as hard as it is to do and easy to say, it's really taking care of yourself and allowing others in your life who can help to help, and asking for that help. I mean, that's often one of the hardest things we do as human beings, is asking for help. But there are probably people in your life that are willing to step up and help. You know, you might have to be an organizer to get that done, but taking care of yourself. You know, my schedule is so insane sometimes, but this morning I'm like, I got to go out and take a walk, because, you know, as a physician, I'm a caregiver every day, not just for my patients, but for my family and, you know, all the other things that we have to do. I've got back-to-back meetings throughout the day. This is one of the fun ones. But I went out for a walk. You know, I went for a 3-mile walk, and that did me so much good. It's a simple thing, but you really have to take care of yourself, because your immune system is going to be depressed if you're tired and, you know, sleep deprived and stressed out. You know, you can't get rid of all the stress of a serious illness, but you can mitigate the effects. You can have positive effects on yourself, and then on that person you're taking care of, by taking care of yourself. I just want to give everybody permission to do that and encourage you to ask for help.
I love that. I've been taking notes as we think about that. And I think that goes perfectly into this next question for Nicole, you know, as we think about taking care of ourselves and advocating for our body. And Nicole, just from hearing some of what you've said and getting to know you over the years as a board member, that we know you're a great advocate for your body and that you do advocate. So how can we remain advocates of our own good physical health during such uncertain times as we think about COVID?
I am so grateful for this question, because what it really comes down to is listening to your body and speaking up to the right healthcare, member or your doctor or your team. If you're sensing that something doesn't feel right, I can't tell you, I mean, literally hundreds, if not thousands of people that I've talked with or that have provided the comment that even after maybe checking in with a healthcare professional, I still felt like there was something wrong. I knew my body well enough to know, what I was feeling. And I just want to put that at the forefront of people feeling comfortable, knowing if their body is telling them something is different, something hurts, something doesn't feel right. And even though we're in a pandemic, how important it is to still speak up if you're experiencing some symptoms like that. And I'll give myself as an example. I'm a breast cancer survivor, and I know how important it is to understand what your body's going through and to be able to report out, what you're experiencing. But when it came to ovarian cancer notoriously has symptoms that women tend to sort of dismiss as something else. You get abdominal bloating, you get extra fluid in your tissues, so it just kind of feels like maybe you've gained a little weight in your belly. And, a lot of times people don't like to admit that that's happening. And especially when I started to experience some of those, I realized that I was shaming myself about, if you go to the doctor, they're probably just going to tell you you need to lose a little bit of weight, and you already know that, so maybe you try to lose 10 pounds before you go, and then the next thing you know, you're kind of making some excuses not to get the care you need. And so I just want to send the message to give yourself a break. Give yourself a break. Just be gentle with yourself. It's okay that you are tired. It's okay that you are scared sometimes or a little depressed. If you're experiencing some significant changes in your body, tell somebody about it. Talk to somebody about it. Don't carry that fear, that uncertainty, that anxiety with you. And, to Dr. Benally Thompson's point, the power of being able to talk to somebody about what you're experiencing cannot be underestimated. So I am such a big advocate and a big fan for being your own best advocate and navigator that you can be. Find out what's going on, get the information you need, and go forward from there.
I love that. So maybe as a follow-up question, as we think about that, so what would you say to someone who's experienced shame or other emotions, maybe that block us from taking action early? Because no one wants to admit, I gained a few pounds, as we probably have in COVID, but how do we advocate and know that we should take things seriously all the time?
Well, for me, it goes back to that sentiment of being kind to yourself. If you had, a best friend who came to you and said, gosh, I'm experiencing kind of some of these things, and what do you think? And, most of the time our first response is, wow, you should really talk to your doctor about that. Why would you not give yourself that same advice? Love yourself enough to listen to what's happening. If your body is sending you little signals, and, report that, find out what's going on. And again, just be kind, be gentle. It's a hard time. And one of the interesting things about having to social distance and do so many things through this kind of technology, a lot of folks, have kind of created their bubble within their own home. And in doing that, you start to realize, you know, I had this huge list of things that I was always going to do if I had the time, right? Well, deep clean my house, or lose those extra 5 pounds, or pick up an extra language. And a lot of people now have some extra time just because you don't have the commute, or you know, maybe you have some extra time in your day, but you're really peeling back all of those layers of the person that you think you're supposed to be, or that you should be, or that you ought to be. And being in a bubble like this really makes you revisit the things that are very, very core to you and very central to your happiness, to your health, that are important to you. And I will say again and again, looking out for your body, looking out for your own health, mental, physical, spiritual, you know, that is a core priority during such a hard time, especially when everybody's juggling so much. Kids at home, work from home, partners at home, you know, how to balance those relationships and those demands. We often put ourselves last on that list. And this is the time, especially, to keep yourself in the forefront and keep yourself well and healthy for yourself and for those who love you.
Thank you.
Yeah, that was really insightful and is related to this next question in a way. So you talked a little bit about how during the pandemic, we have a pod of sorts, or people who are very close to, that we see very often. And so for cancer survivors, that oftentimes includes caregivers. So caregiving is very natural to our Indigenous communities. Many of us have seen our aunties, uncles, cousins, sisters, brothers, etc., all care for someone in our families. And so with that, with technology, at least, we've seen a different way of doing caregiving now. And so my next question is, Nicole, can you kind of like share with us some of the ways that caregivers and other relatives can provide support from a safe distance?
Well, I mean, everybody's support system is different, and those that we turn to, you know, respond in different ways. And this kind of goes back to what Dr. Benally Thompson said about not being afraid to ask for help. And a lot of times people are responding to you, understanding that you might need some support, but might not know what that means or what to do. So anything that you can do to create a little structure around that. I mean, if you literally need a meal train for the next 10 days to get you through, you know, the trough of your chemo, set that up and let people know. If people know that there's something they can do, that sometimes helps, you know, put action to their sentiment of wanting to support you and be helpful. When it comes to our own families, especially as Alaska Native, you know, I think some of the things that we often miss the most are our traditional foods, depending on where we are. And it was such a blessing. I grew up in Petersburg, Alaska. It's a coastal town. It's a fishing community. I just grew up with seafood, love it. And even though I'm up here on the Kuskokwim, I'm up on the river, I don't always get my hometown foods. And somebody was kind enough to send me a cooler of herring eggs, and seaweed and cod and shrimp. And it was just literally food for your soul, food for your spirit, as well as your body. So I think that's one way maybe that families in particular can try to support. And it's amazing what just old-fashioned mail can do as a pick-me-up. You know, if you get a card or a message, because we're so used to the electronic world, what a nice surprise it can be to actually, you know, get something in the mail. So it's for everybody to determine, you know, what their support looks like, but don't be afraid to be specific about it. And as Native families especially, you know, we're so used to holding each other close. Tap into that. we talk often about some of the burdens in Indian country with healthcare, but of course, just as important as any sort of generational trauma that impacts our current present health, even more important, I would say, is tapping into also our inherited resilience. We have thousands of years of dealing with hardship and challenges and obstacles in our way, and thousands of ancestors who've been on this path before. And the fact that we can tap into that culturally, emotionally, psychologically helps tremendously on a, on a journey like this.
I'm gonna kind of, I definitely agree with some of those things and find a lot of insight and wisdom in them. I did want to kind of pivot this to Dr. Benally Thompson as well, and kind of ask from your perspective, what have you seen how have you seen caregivers and other relatives show up for the patients?
Oh, people are so innovative and able to express their love in so many ways. I will say personally, the care packages that our family has gotten from people, who love us, is just, wonderful. I mean, we're all isolated, right? We're all struggling with this, and we didn't go to our ceremonies like we usually do in June. We went for a short time for our second session this month, but it was, my wife has chronic illness, and so she's immunosuppressed, or her immune system isn't as good. So it's that's weighing the risk versus the benefits. The risk of being around other people with the benefit of our our ceremonies and our own traditional ways, our original instructions on how to live our lives the best. But I saw that transform my wife, bring back some of her joy, and I think she rested better, and she's actually able to take better care of herself. Some specific examples I've seen of people, when we first were on COVID, and we weren't allowing any visitors in the hospital, and I work strictly in the hospital. So I see people at some of their most challenging times and sickest times, is a family that would show up on the top level of our parking garage, because she could see from her room, you could see that the parking garage. So they would show up with signs, and they were far away. You had to kind of squint to read their signs, but they would show up and say, "I love you, Mom," and wave like crazy over there. They talk on the phone at the same time. So I think using the new digital technology as much as we can, but that's going back to the old analog, as they say, or the snail mail, or just showing up however you can. I was quarantined when this first happened, because I got a cold right when we started going into the pandemic, and so I was quarantined in our basement bedroom for days, and I can tell you it was tough not seeing my family. I felt a little bit like a prisoner. The food would show up at the door, and I would take it in and then eat my dinner by myself. But my family came when it was warm enough, came to the window, and just on the other side of that window, it's like so much different than being on the other side of a screen. I FaceTime them multiple times a day, but just even that connection and that closeness was different than the digital. Not as good as hugging them, but definitely wonderful. You know what? I wanted to, can I go back to a earlier question that we were talking about? Do we have time for that? So that's that relationship that you have with your provider. with your oncologist. And, you know, Nicole and I both said you need to ask, but, you know, that's a precious relationship. It's also maybe an uneven relationship that you have with your physician, or at least it feels like that. You know, I think, you know, I'm no more important with MD behind my name than the day MD wasn't, you know, the day before when MD wasn't behind my name. I'm still just, you know, Bret. And, you know, I have a responsibility to my patients in a different way as a physician, and the people I take care of. But, you know, we're still human beings. And so that relationship we have with that other person, our physician or our provider, is really important, and it doesn't always fit. You know, I just want to acknowledge that you know, not every person you go to for a service or a product is going to be a perfect fit for you. You know, and in some systems, you know, especially in Indian Health Service and tribal systems, our choices of providers can be pretty small, or we just don't even have a choice of a provider. But, you know, if you have the luxury of shopping for your physician, then I encourage you to do it if that relationship isn't a good fit. The other thing I would give you permission to do is talk to that person. If you have this, if you have the ability to do that from your heart, to let them know that they're not actually addressing your problems like you feel like they should. You know, if you're telling them over and over again about a symptom that you have, like Nicole mentioned, and you don't feel like you're being heard, then there's something's amiss there. It might be you, it might be the provider, but I think talking openly about that opens up a better dialogue. And if you feel like you're not being heard, or as a doctor, if I'm actually missing what you're telling me, then that's on me, and I would appreciate it if you bring that to my attention. You know, I don't like being wrong or doing things wrong any more than the next person, but, you know, I have to be humble enough as a physician to listen to my patients, and if I'm not hearing them, that I'm doing something wrong. So I think, you know, try to improve that relationship first, and if it doesn't work, if you have the luxury of asking for a different provider, then I want to give you that permission also.
One thing I've really enjoyed about this conversation so far is a lot of the conversation around our Indigenous ways, including diet, as we've heard a little bit about, our nutrition. That's been a lot of fun, making me very hungry. And then also just the mention of humility, knowing that many communities consider that to be one of the 7 grandfather teachings. That's been really nice. So this is related in the sense that we have seen Native people, all people right now, experience this pandemic. One of the words that we are often hear these days is that this pandemic is unprecedented, which means that we haven't been here before. And while this is true in the sense that we haven't experienced a pandemic at this level, we know that as Indigenous peoples, we have experienced pandemics before, especially within our own ancestry. That being said, our bodies hold a lot of memory of collective trauma that our ancestors endured. And so they have that inherent resiliency that you mentioned earlier, Nicole, which is really beautiful. So my question for you both is, what advice do you have that can speak to this ancestral strength and inherent resilience within all of our relatives, but especially those living with cancer and affected by cancer as caregivers and families?
Nicole, do you want to address it first?
Sure. You know, it's kind of interesting because what is often the case among American Indian or Alaska Native families is that it's sometimes hard to talk about cancer. Many Indigenous languages don't even have a word for this disease. And to try to create a culture where it's okay to talk about something that might be wrong with you physically is super important. And we know that even mental health stigmas are still so strong and need to be broken down. So to be able to talk about illness among our families and among our communities, you know, anything we can do to keep modeling that behavior is super important. And I think of how lucky we are as members of Indigenous communities, as members of tribes that have thousands of years of history behind us, to have such a rich resource to be able to turn to even use, you know, sort of historically for your own strength. But the closer you get to your own family, those histories, that experience, to be able to draw on that and to have such a far look back makes you feel less alone when you're facing something like cancer, which can be one of the most isolating things in the world. That sense that you have strength behind you, even if what you're experiencing is brand new to you or to anybody in your family. There's such a well to draw from of our ancestors and, you know, those who are close to us, to when you feel like maybe you can't, you know, get out of bed that day for yourself, to think of that strength and of what our people have been through before, and to draw on that it's a remarkable thing.
Thank you, Nicole. You know, we have been through this before, multiple times over. You know, we've been through much worse pandemics. That our populations were, you know, we lost so many people when those diseases were first introduced to us. Just like this new, that's what novel means. You know, when they say the novel coronavirus, it's a new virus to us. So we're facing the same things our ancestors and our grandmas and grandpas, you know, from not that long ago faced. You know, I think part of the beauty of being Native, whether you're faced with living with a serious illness or a cancer, or as a caregiver, or as a physician or nurse, you know, whatever your role is in this team, you know, and each person has a huge team, not just a medical team, but a team, is how we understand the world as compared to some of the other people that might be on this team. You know, Nicole points out that we understand the world in a very different way. I feel so blessed as a scientist and a physician that I get to look and understand the world and understand science in a way that kind of transcends just the pure science portion of it. You know, I understand the energy and the spirit behind medicines, and the energy and the spirit behind the love of your family and your caregivers, but also the love of that physician or that nurse, you know, gives in taking care of you, and how important all those things are. So I think, you know, taking joy in having that extra or that different view of the world, and that very positive view of the world that's been handed down for so many generations from the original instructions that were given to us as people, that we've carried forward through generations, and that survived despite all these terrible diseases that we've been faced with, and that we'll continue to be faced with. You know, knowing that we can use both our traditional medicines and our, you know, this modern Western medicine. You know, I see the positives and the strengths of both, and the shortcomings or the things where those things don't work and I need to turn to the other one for better help. You know, a CAT scan only sees so much. Our medicine people see much deeper than some of the imaging devices that we have at our disposal. So you know, use all your resources, you know, everything that you can bring to help you get through and live with this disease. No matter what the eventual outcome is, you know, just live as well as you possibly can with all the help that you have around you.
Goodness, Chief, those are great words.
I know we are at 4:01. I thought I saw a hand raised. And I don't know how to answer a hand raise. And I want to be respectful of everyone's time. So I think if folks have questions, please feel free to email us at info@acaf.org. And we will definitely reach out to Dr. Benally Thompson and Nicole to get those questions answered. Again, I want to thank you both for joining us today and sharing your wisdom with us. And again, big thanks to everyone who joined us. Misha for always working and helping us craft some really great questions. If there's any last thing from Dr. Benally Thompson or Nicole that you want to share before we end today's webinar.
Just good ashish to AICAF for sponsoring these kinds of conversations and for having me here today. Good ashish.
Yeah, and there are people like Nicole in your communities who can, you know, guide you and help you through this. But if you need some extra help, AICAF is here to, you know, help guide you and find those connections for you. So, Chimigwech, many thanks, and Gigawabaman, I'll see you again.
Kitabi Pilamia, thank you, Miigwech. We look forward to our next COVID and cancer chat. We will definitely share that information on the next topic. And again, thank you for everyone for your time and your energy today. Have a good day.
Miigwech. Kikwabaman.